Good morning, everyone. I hope you're having a great day. It's beautiful outside. Glad you could make it. I've been in Delaware for 2 years now. We moved after living in Georgia for 18 years. And while I was there, I worked with older adults at the Coastal Georgia Area Agency on Aging. Georgia was one of the second round of recipients for ADRC grant funding. And when I found out ADRCs were coming to Delaware, I was really happy. And then when I found out our agency, Jewish Family Services, would be involved in delivering support services, I was really happy because I got to see firsthand the value and the benefit of ADRC services in the community. And what's really wonderful is that it allows the community, it allows you as the professionals making referrals, it allows families, it allows the consumer to all make decisions that promote their independence and well-being. Whether it be in a community setting, and sometimes it is in a long-term care facility, because that is where their needs can best be met. So having said that, the other nice thing about ADRCs, in fact, in Georgia we didn't call them Aging and Disability Resource Centers. As Chris said, it's not really an entity, it's a network. And in Georgia they call them Aging and Disability Resource Connections. And we were able to successfully help folks who needed help across county lines, and by the way, Georgia has 159 counties, and across state lines. So individuals who are leaving Georgia to go to another state could also be helped. And that's beginning to happen here in Delaware. So this is really a very exciting time in the area of long-term care services. As Chris mentioned, you're going to see this graph, this chart, a few times this morning. It all begins with you, whether you are the administrator in a nursing home, whether you are a hospital discharge planner, whether you are another agency in the community, and it could even be just the general public. This is where the process begins with the community. The referral comes into the local contact agency, in this case in Delaware, it's the Division of Services for Aging and Adults with Physical Disabilities. And from there, the decision is made as to whether or not this is indeed appropriate for ADRC support services. Again, I look at this whole process as being, a four-legged or a fourfold process, sort of like a table with four legs, without any one of the legs. Things can be a little shaky, but when the process is cohesive and coordinated, it works very well. So my purpose here today is to talk with you about what are the ADRC support services and how do they work. Just wanted to tell you very briefly, I'm not going to go into a lot of detail about what Jewish Family Services is and how we became involved. JFS has been around for well over 100 years, providing a variety of services to folks in the community, everything from mental health counseling to youth development services, communal volunteer services, and of course care management services has been one of our primary departments for the last 5 or 6 years. Care management services, which comes under my direction, seeks to provide the information, the referral, the support services, the navigation of the service delivery system to older adults and persons with disabilities. We've been doing this as an agency, but also as part of the Delaware Aging Network. As Chris mentioned, the Delaware Aging Network, or DAN, is a partnership in the ADRC, and I believe it's the strength of our partnerships that enabled us to receive this grant, because we do have connections across the state. We do work with other DAN agencies to deliver ADRC support services, and those appeared on the previous slide. Modern Maturity Center and CHEER help us to serve Kent and Sussex counties. Again, they've got a great deal of knowledge when it comes to delivering older adult services. And we've also engaged Easter Seals to help us to connect with the disability community, because we all know that ADR services are not just for the elderly, they're for adults of all ages who need information and access to long-term care. And just to let you know too, we've been getting a lot of referrals since January when we started. To date, it's actually probably closer to 350 referrals that have come in, not only from nursing facilities to the local contact agency, but from the community as well. These include social service agencies, senior centers, the general public, and acute care settings. I'm going to give you a very broad overview of what ADRC support services consist of. You do have a handout in your packet that describes these in a little more detail. There really are three components to ADRC support services. One is options counseling, and I'm going to go into a little more detail with each of these in a minute. And that is, options counseling really can take place just about anywhere, but quite often this is the avenue we take when we're working with individuals who are in long-term care facilities, who have expressed a desire to transition to the community, either from verbally expressing that to the social worker or because they've answered yes in the MDS Section Q regarding their desire to return home. Support services also assist individuals with their access to benefits enrollment and finding supports and other ways to help them gain access to housing. So we can assist folks with completing the application process that, as many of you know, can be cumbersome and nearly impossible for folks who are experiencing challenges due to their age or their physical disability and even their cognitive functioning level, either due to a traumatic brain injury or due to the advance of dementia. We've also begun recently working with hospital discharge staff as they get ready to discharge individuals into the community. This is an avenue that allows you to tap into some additional resources that could benefit the patients that you're discharging from the hospital. And we'll talk a little bit more about that. Support services can take place just about anywhere, as I said, either in long-term care facilities and hospitals. We meet with people in their homes. We meet with people in senior centers. We meet with people who are homeless. And so those folks, we might meet with them in their hotel room or in a shelter, and even in public places like a library, wherever it's convenient for the individuals where we will go. Okay. A lot of people ask, what is options counseling? Here's a definition for it: an interactive decision support process. This allows us to work with folks on an individual basis to find out from them what it is that they feel that they need, what it is that they are looking for in the way of living out their years with long-term care support services. Many people think that their only option is a nursing facility, but when they learn what community-based supports are out there, they're often quite surprised to find that yes, they can do it with the right kinds of support. And so the options counseling process is one where the care manager will sit down with the individual, look to identify, they take a picture of where they are now, what their capacity is for independent functioning, and help them to determine what long-term care supports it is that they need. This is a nifty little slide that Chris provided to me from the ADRC website, the national website. Basically, support services function as a bridge. We're often able to step in. For folks, there are a lot of people out there who've fallen in the cracks. They might find out where to go for help, but actually accessing the help they need more help with. And so we're there to prop them up, help them get there, and help them make the decisions that will most benefit them. Once we've done our part, we can then refer them back to the local contact agency or to other agency resources that can best meet their needs. So a quick snapshot of the process. This is the general process. This is support services across the spectrum. Basically what happens is we get the referral, and then based on the type of referral we receive, we have to respond within 1 day if it's from a hospital, or within 5 days if it's a referral from the community or a referral from a long-term care setting. At that point, we'll meet with the individual. We will include the family if there are surrogate decision makers or guardians involved. We will also include the facility staff, because after all, facility staff have been working with this individual for a long time, and they have a very good picture of what it is that this individual is capable for doing for themselves and what supports they would need in the community. Then depending on what it is they need, if they need help with enrolling in benefits, we will work with them to do that. And we assist and we advocate. And that's a big piece of this too. A lot of times folks feel they don't have a voice, especially when they're dealing with government. They often feel that, you know, they just don't have a choice in the matter, and the reality is they often do. Okay, and once we're done with that, when we're finished with the individual, we will report back to the ADRC. We let them know what the outcome was for that individual. Some individuals opt not to work with us, and that's perfectly fine. Again, that's their choice. But for those who do want to work with support services, our assistance can last anywhere from a couple of days, you know, where we help them to achieve what it is they want in just a short time. Sometimes our assistance takes place over weeks or months because the situations can be very complex and difficult when there are challenges. Okay, so this in options counseling, when we've been asked to provide options counseling for an individual, whether they are in a long-term care facility or in any setting really, we initiate the contact with the facility. We schedule a face-to-face visit with the client and the social worker if they're available. And we discuss what their, with the individual and with the family member, what their options are for long-term care. And this is where if we're in a facility, this is where we go into great detail about what care transition services are out there. Especially for folks who've been in a facility for a long time, they need added supports for discharge to the community. We take a lot of time to review what those options are. Some people want to leave a nursing facility and they don't want care transition support, and so we fill them in on what their community-based options are. Okay, while we're there, we complete an assessment form. There is one in your packet. You can see what it looks like. And by the way, when we do complete an assessment, we've heard your request for follow-up, what happens afterwards. We have actually started returning those assessments back to the ADRC, but we are also copying on that communication. We are copying the referral source. So if you send a referral to the ADRC, and they ask us to step in and do support services options counseling, when we send the assessment back, we will copy you so long as your email address appears on the referral form. So when you complete the referral form online, please make sure to include your email address. When we also let you know when we get your referral, and we'll let you know who the counselor is that has been assigned to this particular resident. A lot of the work that we're doing right now, in fact, is assisting individuals with enrollment support. If any of you have ever completed a Medicaid application, you're aware that it does take a lot. It takes a lot of knowledge about what an individual's current financial situation is, and it requires a lot of documentation. There's just a lot of questions, and for some people the process can be overwhelming. And so we do spend time working with individuals to gain access to the benefits that they are eligible for and that they need. And that can include Medicaid services, food stamp services, housing applications, anything of that nature that can be overwhelming. We've assisted people with their disability applications to Social Security. Quite often these folks have tried applying in the past, but because the process is so overwhelming, they stop. They just don't complete it. So we step in to help. We've also begun working with the hospital discharge planners. The challenge for us here is to get to the hospital and get to the patient before they're discharged home. As you know, patients can be discharged rather quickly. So our goal is to make connection with the social worker and with the resident within 24 business hours. We've received not a great many referrals from hospitals, but I think the word is just starting to get out. So if you're in a hospital setting and you're working with an individual who may not have a great support system at home, who may need help gaining access to benefits or other services, you may want to think about communicating with the ADRC and sending in a referral, because we can help that individual once they are home. As Chris said, she's going to show you in just a bit how you can make a referral. It is rather easy to connect with the ADRC. She's going to give you information about how to access not just the ADRC, but also a database of services that can help you as you work to discharge the individuals that you work with. I wanted to give you an example, if I have 3 minutes. I'm good? Okay, great. I want to give you an example of a kind of individual that we work with. And I actually thought it would be most effective if I just read straight from the case notes. This isn't very, very lengthy, so bear with me. But I think it will give you an idea of how the process works. We received a referral from a care manager in the Division of Aging for this individual in early June. And we received, the first thing that this care manager did was June 6th, left a message for the care manager because the referral requested that I do so. And then on June 13th, left a message for the care manager. Again, care manager may have been away on vacation. I don't know what took so long. But in this case, we followed up in a week. Talked to the care manager, and the care manager told me that the client has a dog that is part pit bull, and I should ask to have it caged when I arrive. She said going to the home was the only way to touch base with the client because there is no telephone. June 17th, arrived at the client's home. Client did not seem to comprehend why I was there. Client's sister came downstairs and both seemed very suspicious of my motives. I assured them that I was there to try and assist and asked if they would allow me to discuss their options with them. Both said that they did not want any help. A nurse arrived and I told her my role. She explained to the client and his sister that I would be helpful and they should accept the help. They said that they would. We talked at length about their needs. Client showed the letter saying that he had been declined for Medicaid. I called KB and talked to a guy in her department who said that the client had been declined other Medicaid products, assuming maybe that was like a SLIMB or Medicare low income assistance type of help, but not the Medicaid waiver. Client said that he would be willing to complete the application but did not have one. I advised the client I would get an application and return next week to help him complete it. Next week, went to the client's house and with the Medicaid application. The front door was open, and it looked like people were probably home, but no one answered the door. Sister had given me a cell phone number that she said might work, so I called it and left a message saying I was there. No one ever appeared at the door. June 28th, went back to the client's home. Again, no one answered the door, although the front door was open. I knocked, yelled through the door, and left a note indicating why I was there and that I would come back. July 8th, met up with the client and sister. We filled out Medicaid application and made a list of the documents that they would need to accompany the application. But they were not able to locate any of the documents at the house. So we talked about making sure to keep all mail in the coming weeks so that we can accumulate necessary documents. Advise them that I will check in weekly now until we have all the necessary documents to submit the application. July 13th, stopped at the client's house to see if they had located any documents for Medicaid application. They said that they had found Social Security cards in the client's ID. Sister told me that she could not really remember what else they were supposed to look for and that she could not read. So the list I'd left them was not useful. We didn't know that when we first left the list. I reread them the list and asked them to try and remember as best they could. I advised that they keep all mail so that I can review it with them each week and see if there are any documents included that we need. July 13th, called Social Security to see if they would send out a copy of the client's award letter so we could use it for a Medicaid application. Social Security told me that client had to come to office in person. So to answer personal questions about himself or the phone to get a copy of award letter. I should have told you initially that this individual has some severe cognitive deficits and he has a really hard time remembering what it is you might have just said. In fact, he had a hard time relating to the care manager what his birth date was. So you can see there were some severe challenges here. Okay, I advised Social Security that both were unlikely as client has limited mobility and no transportation, and that he often does not understand basic questions when I ask him myself. Social Security said these were the only options. I called Medicaid office and talked to Karen, who said that in a pinch, I could make a copy of client's check when it arrives, and that should suffice for the Medicaid application to verify income. Okay, stopped at the client's house to see if any useful documentation had shown up in the mail. Asked the client questions like his date of birth and Social Security number to see if he could answer sufficiently to call Social Security and request a copy of his award letter. Client was unable to understand what I was asking him and unable to answer. I asked the sister if it would be okay for me to make copies of checks when they arrived. She said that was okay. Checks are expected on the 3rd of the month. So I arranged to be there at noon on August 3rd to make copies of checks before they cashed them. August 3rd, met client at house, collected all the documentation they had been able to collect over the past month and the client's Social Security check and made copies of all. Called the bank to have the past 3 months' statements faxed to me, mailed the whole packet with application to Smyrna State Services Center. And then on the 8th, the care manager confirmed with the referring care manager that the client has had the case reopened with Medicaid and that someone will go out to do the CSP assessment with the client. This care manager was advised by the mail-in department at DMMA that they will honor the client's application as soon as they see him open in their system. So here's a really good example of an individual who had some real significant challenges. Not only could he not get out and get to Medicaid for his appointment, but he just couldn't collect the documents, and he couldn't answer basic questions to verify his income. So I thought I would share that with you. We did find out later that his application, I'm not sure, it may still be pending, actually. We're waiting to hear. Just want to give you a quick list of the folks who do support services with us. These are folks from across the state. If they should come to your facility or you should get a phone call from one of them, you should know who they are. I've given you their names and who they work with. Okay. At this point, I will introduce what I call the fourth leg on the table, Andy Wozni and Eddie Ashby, to talk about community transition services available to folks when they leave a long-term care facility.